Good afternoon. My name is Ed Hickey, and I serve as AAKP's Vice President and Chair of our Veterans Health Initiative. I myself am a kidney patient and have also been a caregiver, as there's a history of kidney disease in my family. AAKP is the oldest and largest independent kidney patient organization in the United States, founded in 1969 by patients for patients. It was one of our early board members, Shep Glazer, who dialyzed in front of the House Ways and Means Committee to help pass the Medicare ESRD program that has saved more than 1 million lives since 1973. Since that time, AAKP has continued its efforts to support sound policy that supports all kidney patients and also focuses on providing education to individuals across the disease spectrum, while also engaging in research that strives to bring new innovations to the field to enhance care and improve quality of life. Today, I am very pleased to recognize two outstanding individuals who exemplify AAKP's vision of innovation with the 2022 AAKP Medal of Excellence. The Medal of Excellence is the association's highest honor for healthcare professionals, recognizing individuals who are committed to improving and extending the lives of all kidney patients through advocacy, research, technology, and quality-driven treatment that protect patient dignity and fully align with patient aspirations. This prestigious award program recognizes individuals across the healthcare team. However, today it is my distinct honor to announce the 2022 Medal of Excellence honorees in the Special Recognition Breakthrough Innovator category is Dr. Robert Montgomery and Dr. Shuvo Roy. Dr. Montgomery is chairman and professor of surgery at NYU Langone Health and the director of the NYU Langone Transplant Institute. He was part of the team that developed the laparoscopic procedure for live kidney donation, a procedure that has become the standard throughout the world. Dr. Montgomery and the Hopkins team conceived the idea of the domino paired donation, the Hopkins protocol for desensitization of incompatible kidney transplant patients, and performed the first chain of transplants started by an altruistic donor. He is credited in the 2010 Guinness Book of World Records with the most kidney transplants performed in one day. Dr. Montgomery is considered a world expert on kidney transplantation for highly sensitized and ABO incompatible patients and is referred the most complex patients from around the globe. As a researcher, he has had clinical and basic science research supported by the NIH. Throughout his career, among many of the research interests, Dr. Montgomery has dedicated much of his career to bioartificial organs in xenotransplantation. It is for his work in xenotransplantation that is being recognized with an AAKP Medal of Excellence award. Dr. Montgomery was named previously by Newsweek magazine as one of America's greatest disruptors, which is a title I think all individuals impacted by kidney disease can celebrate. As Dr. Montgomery is someone who dares to change the status quo kidney care by determining how to advance transplantation so more individuals experiencing kidney failure receive the greatest gift, a second chance of life. As a heart transplant recipient himself, Dr. Montgomery has a unique perspective of what it means to live with chronic disease, and while also having the clinical expertise to make profound change in the arena of transplantation. Congratulations, Dr. Montgomery. I invite you to say a few words.
So thank you, and I want to acknowledge just how thrilled I am at receiving this tremendous honor from the AAKP, and it's of special significance because I know that it involves both patients and peers, and that makes it even more wonderful. And I want to accept this award on behalf of the entire team at NYU Langone, who was involved and made the first successful pig-to-human xenotransplant successful. We have an incredible team here, and things like this are always accomplished by a team working together on an important problem and being laser focused. So thank you to our entire team and to the AAKP for this tremendous award. So I really want to take a moment, though, to talk about the future of xenotransplantation and how organizations like the AAKP and patients are going to be critically important for the next steps. I think there is a unique moment in time right now to really advance xenotransplantation into the clinic. And we have, I think, the public behind us, the public perception from some of the really amazing things that have happened in the past 6 months in this field has been very good. And I think now is the time to end the really senseless loss of life that occurs while people are waiting for a transplant. So the biggest problem that we have in transplantation right now is there are just not enough organs for everyone who needs them. And in fact, more than half of the people who would be helped from a transplant never make it across the finish line. And unfortunately, those voices are not heard. And so we have to speak for them. We're the lucky ones. As you all know, probably I am a heart transplant recipient, and I was extremely fortunate, but I had to get so sick and have many near-death experiences before I was sick enough to receive a transplant, and that's because of the limited supply. Xenotransplantation would offer the promise of a sustainable, unlimited supply of organs so that no one would have to die waiting. But we need to let the government agencies that regulate transplantation and provide funding and our elected representatives know that this is critically important to the future of transplantation. Now, we've just come through a pandemic where we did something that was really remarkable and incredible. We were able to, in the shortest time that I think any vaccine has ever been developed, to find a way to really lessen the health burden of COVID-19 on vulnerable populations by developing a vaccine in record time. Now, that was a top-down effort, so the White House decided this was our number one priority, and then really energized all the government agencies who then provided grants and support for the scientists and medical innovators, and look what we did. Xenotransplantation is going to be something very different. I think it's going to be more like the incredible advances that were made in HIV and AIDS, where patients played the major role in invigorating the field and getting the government behind the research that resulted in treatments for HIV and AIDS. It was patients and patients advocacy groups that really made the difference. And that's what is going to be required for xenotransplantation. So groups like AAKP and others that advocate for patients, and the patients' voices themselves are going to be critically important. So I really want you to join me in making this our number one priority, eliminating the loss of life that occurs waiting for life-saving organs. Xenotransplantation right now, I think, is the most promising answer to that. So please get behind this and let your voices be heard. Thank you so much for this incredible honor. And I am just absolutely thrilled to be here with you and to receive this award. Thank you.